Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. As all of you know that Canada-India Network Society organized its conference from June 18th till 20th, and there were a lot of speakers from around the world who spoke on how integrative thinking needs to be adopted in our health approaches. Today we are very proud to present to you Dr. Farah Shroff, who has been working a lot on lots of issues. Dr. Shroff spoke in this conference about her project in India on maternal and women's health. So let's welcome Dr. Shroff, and we will continue with the discussion and learn from her as to what all has been done. Dr. Shroff, welcome to the program.
Thank you, Harpreet.
Thank you very much, Ji. So before I let you speak, I would just like to let our viewers know about a little bit about you, because there's so much to talk about you that even if I keep on speaking for the next 20 minutes, your bio will not finish. But briefly, I would just like to tell our viewers, Dr. Shroff is an incoming Harvard Fellow in International Health at the Harvard School of Public Health. She's principal of Shroff Consulting, a public health, education and social issues consultancy company that focuses on research, education, and social issues consulting. That focuses on research, writing, facilitation, and more. She has also worked in the Department of Family Practice at the School of Population and Public Health in UBC Faculty of Medicine. Her main areas of research are holistic health and community development within a social justice framework. She is also passionate about the health and human rights of women, and she has worked in various countries to improve the health of women. She founded and leads Maternal and Infant Health Canada, a global public health collaborative that focuses on improving the lives of women and children through education, research, and innovation. And apart from her holistic skills, she is also a teacher of yoga, dance, self-defense, meditation, and other mind-body paths. So we welcome Dr. Shroff to you to the program, and for the next 15 to 20 minutes, we would like to know from you that you spoke in this conference about women's and maternal health in India. So could you elaborate in details as to what is the situation in India, how India is improving, or are still the conditions the same, and what all you have done in your projects over there?
Sure. It's a delight to be here. Thank you so much. I'm honored to be speaking with you, Harpreet, and I'm always so grateful to the Coast Salish nations whose lands I live on for their stewardship of this beautiful land. I founded an organization called Maternal and Infant Health Canada that works very closely with the Canada-India Network Society. So I have been at all of the CINI conferences, helping to organize as well as speaking. And there's a lot of synchronicity between what the Canada-India Network Society does and Maternal and Infant Health Canada. Maternal and Infant Health Canada also works primarily in India. We are an organization that focuses on improving the lives and the health of women and children through education, research, and innovation. And our innovation is traditional medicine or integrative medicine. In India, that is primarily Ayurveda and yoga. And in different parts of the world, it can be traditional Chinese medicine or other systems of medicine. But it's certainly, the innovation is focused on the extant systems of health promotion, disease prevention, treatment, rehab, and palliation, which have existed for thousands of years in India. And thankfully, right now, India's government, since about 2014, has had a ministry called Ayush, which is Ayurveda, Yoga, Unani, Siddha, and Homeopathy. And after many hundreds of years, this ministry has come about to bring about the reflourishing of these traditional systems of medicine within the motherlands. And it's taking some time. Ayush is taking some time to become fully established. But what we see is now, really for the first time in a very long time, this recognition that traditional systems of medicine are really important in the Ministry of Health in India. And so Ayurvedic physicians, Siddha physicians, Unani physicians, others who have not been part of the mainstream in India have now become more welcomed into the fold of the Ministry of Health. And so Maternal and Infant Health Canada is very pleased that our work coincides with the birth and the growth of Ayush, because we're very interested in improving the lives and health of women and children, particularly in this tragic reality that a large number of women are still dying during childbirth. Most of these deaths are completely preventable, and it starts very young. When a young girl is not nourished properly, because there are still some parts of India, not that many parts, but there are still some parts of India where girls and women are not fed as much. So that means that a girl will grow and not be as nourished as she could be. And then she might get married quite young. And then she might be bearing a child also as a teenager or as a very young adult woman on a body that has never been very strong and very nourished. And because there is a very long-standing problem in India of iron consumption, many women know. I've been to India and asked many women in small villages. They know that they might actually have some problems of bleeding during childbirth. So they take their sister or they take somebody else with them as they're about to give birth, because it's a well-known problem that women have iron deficiency, and unfortunately, many women do have postpartum hemorrhage, and some actually pass away as a result of that. So Maternal and Infant Health Canada is really trying to work in this field of improving the lives of women and children. We work with a large number of partners. The Indian Institute of Public Health is one of our main partners. We have some very good collaborators there who are doing research with Indigenous women in Gujarat. We also have other partners in Gujarat as well as in other parts of the country. So we work mainly in Maharashtra, Gujarat, and then we have partners in the Hyderabad area as well. There is some very exciting things happening in India in terms of trying to improve women's health. There are a lot of people trying to humanize childbirth practices, because at the same time as there is this slightly troubling trend of C-section rates climbing very, very high. Some facilities have almost 100% C-section rates. And that's partially because there's a kind of a new trend in India where some of the movie stars and others are talking about how they had a cesarean section and this was a very good thing. And so now middle class women and even say women who really can't necessarily afford a C-section are now saving and saving and saving their money in order to have a C-section. So we're working with groups who are trying very much to combat this trend, because a C-section is wonderful when a woman needs to have a C-section, but it's not necessary for more than approximately 15% of births. And so when we see 100% C-section rates, we know that this is also something to combat. Maternal and Infant Health Canada is very much interested in seeing the best health counts possible for women, children, and communities. And so when we don't need interventions, it's very important to avoid them. In Canada and in many other countries, we have managed to reduce our C-section rates in many cases, and there has been quite a bit of work to try to do that. A C-section is a major operation, and the human body really does know how to give birth, and the human body is really good at giving birth. And that's really one of the places where yoga and Ayurveda thrive, is in this place of natural childbirth and natural living. Uh, Yoga teaches us to feel very connected to our mind, body, and spirit, to feel in our Anahata Chakra a deep sense of self-love, and to open our hearts to other people and feel a lot of love for other people. That certainly is the gift that many mothers give. We all know that we go to our mothers because she does usually have an open heart for us, and that is the place where most of us go when we're not feeling well. We go to our mothers, and the mother is often the one who will take care of her parents and her siblings. So we know that women really do hold up the world, partially because of this place of the open heart. Women are taught to be nurturing and gentle and kind, and to have that chandani, that receptive moon-like prana, and we do want to encourage women to take care of themselves as well, because one of the things about being a mother is that we do love taking care of everybody else, and sometimes we don't take care of ourselves. So that's why it is really important to focus on the mother, because taking care of her will help her to take care of everybody else. And besides that, mothers are worth it all on their own. Just taking good care of women is really important. So, yoga teaches us to really focus on this Anahata Chakra, on this part of ourselves, which we really like. And becoming a mother, often women will report that that is what they like the most. It's those gentle, nurturing, loving parts of themselves which come out as soon as they've given birth. And so we also want to encourage all of us to be compassionate and caring to each other through these practices, yoga and Ayurveda. Yoga certainly teaches us that. There are 7 chakras, and the central one is the Anahata Chakra. And really, that is where a lot of the focus is in the chakra system, on opening the heart, this green chakra that is in the center of our chest. In Ayurveda, we learn a lot about nutrition. Ayurveda teaches us to eat well according to our own prakriti. This is one of the beauties of Ayurvedic medicine. It teaches us to really learn about our own mind and body. The prakriti is this mental, physical constitution, which makes all of us fully human. And we're not all the same. That's the beauty of Ayurvedic medicine. There are many systems of medicine now trying to elucidate this concept of precision medicine. And I believe that these were birthed within Ayurveda, because Ayurveda says that we are all one of 7 different prakritis. The basic 3 are called Vata, Pitta, and Kapha. The Vata being the more air element, the Pitta being the greater fire element, and the Kapha being predominantly earth element. And we are all combinations of these 3. So I, for example, am a Pitta Vata, a combination of the fire and the air element. Other people are Kapha Vata. My son is a Kapha Vata. We are all combinations typically. There are very, very few people who are this perfect balance of the Vata, Pitta, and Kapha. But knowing our Prakriti is a very beautiful way to know ourselves, and a way of understanding what kinds of nourishment we should be eating every day. What is it that the Pitta Prakriti, for example, should be eating? The Pitta Prakriti, say in the summertime, in a Pitta time, like we're just about to come into summertime now. So those of us who have a more fiery mental, physical constitution in a more fiery time of the year should be eating more cooling things, more cucumber, drinking a lot of water, those kinds of things. These are very, very helpful things for all of us to know. And they're the kind of things which many of our grandmothers actually did know. My granny used to say to me, Farah, when you're having mango in the summertime, that there's a lot of pitta in the mango, so make sure you have some dahi, have some yogurt, because that will cool you down. It is one of the beauties of Indian culture that Ayurveda has been blended into the culture for millennia, and sometimes people don't even identify it as Ayurveda, but it's something that has become so part of what we just know and what our grandmothers taught us, that we just think it's part of the kitchen knowledge that we all grew up with. So we are trying to really encourage Ayurveda and yoga to come back to India as well as other parts of the world, because this kind of spiritual, holistic knowledge will help all of us to be self-reliant and take care of our own well-being. You just have to invest some time in learning how to do all of these things, and there are many courses that we can take. But once we have understood the basic principles of yoga and Ayurveda, these health promotion and disease prevention principles can help us a great deal. And they certainly can help in women and children's health, especially for nutrition, which is a very important part of keeping us all healthy.
Dr. Shroff, you've touched a lot of issues, and well, definitely these are the issues which we need to discuss and start working on those. So, thank you for sharing your wisdom with us. I have a few questions from what you have talked. The first important thing you have talked about is precision medicine, and also we know that in India, because this conference focus was the wisdom of the East and the modern medicine of the West. When they combine, they can produce wonderful results. And Dr. Garg was focusing that this conference is addressing the issue of chronic diseases. So when you see what you have done in India, what do you find amongst the women about the chronic diseases because of the pressure they work through and the kind of challenges they have to face? Uh, can you talk a little bit about this, the issue of chronic diseases among women?
Yes, the chronic disease of diabetes is almost a pandemic in India. It's a very serious condition. And I believe that's partially because most Indians are vegetarians and the diet focuses very heavily on carbs and sweets. So a lot of the solution for diabetes does lie in changing to a more sattvic diet, according to Ayurveda. Having a lot more greens in the diet. When I'm in India, I eat a lot of roti, potato, and chawal. Right, it's a lot of rice, potato, and roti, and then and then we all love our mithai. So I must agree, I love it too. I love a good barfi. I love ras malai. I love
Right.
Indian sweets. But the diet is too much heavily focused on things which are really not good for our blood glucose levels. So a much higher concentration on green. I always say if you could divide your plate in half, one half should be green vegetables, the other half divided it into two. One quarter would then be your protein source, which could be whatever that happens to be. It could be paneer or tofu or egg or whatever sources of protein you do eat. And then the other could be your rice or your roti or whatever else the carb is. But currently the plate looks very different than that.
Absolutely.
So, yes.
But on
And
the
drink
other hand, our kitchen also, the kind of spices and herbs that we use, especially in our Indian cooking, they can be very beneficial. And our elders, we didn't find these chronic diseases amongst them because they were working and they were, you said that things have changed now, but still, if we understand the importance of the kind of food that we have been eating, then definitely that can have a good impact, and that malnourishment or overnourishment, what we say in our culture that we are seeing now, that can be stopped and that can help us live a happy, holistic, healthy life.
Yes, we do see that the whole world is tending towards sedentary lifestyles, spending a lot of time sitting. And in my field of public health, we say that sitting is the new smoking. There's a lot of research which shows that sitting is connected to at least 40 different chronic diseases. And so we are trying to encourage people to keep moving. Again, back to things like yoga and Ayurveda and walking and being in nature. These are things that are traditional to our cultures. And to just encourage people every 20 minutes, take a break, get up, stretch, move, make sure that you are not feeling numbness um, in your buttocks. When we feel numbness in our buttocks, we know that the brain is not working very well. So we want to keep moving. That is how the brain works better. That's how the cardiovascular system works better. Our bodies need movement, stretching, just moving around generally, but we need to move our limbs, breathing fresh air. We need to do that outdoors. And particularly during this time of COVID, of isolation, being outdoors is really, really important, because that is one of the things, despite people being vaccinated or not, that they can be doing outdoors quite safely, staying 2 meters apart and socializing with each other as well.
Right. And Dr. Shroff, another issue what you have touched upon is the you have been working in various countries, in India also in other countries, where a major issue which women face is infanticide and feticide in India. What does your research tell about that? Is it declining or is it still at the same trend, that patriarchal mentality that exists in the communities? How is that impacting the health of women?
India really is moving forward in many ways. There is a phenomenal movement of men and women who are really changing social norms. And yet, there are still many areas in the country which are still very male dominated, where violence against women is a pernicious and almost daily reality, and where there is a strong preference for male children still. Those areas are learning and growing, but they still exist. So yes, there is still this preference for testing a female during pregnancy to see the sex of her fetus, and then to have feticide if it chooses to be a female. And
Right.
yeah, so that is still in existence. But I believe that there is a great deal of social change in India. Our group has worked in Odisha with indigenous communities, and it is really quite new that a lot of indigenous women are now leaving their small villages and coming to the cities and gaining more education and working with other people. The ashas in India, the workers who are paid by the government to go and educate people, are working with more and more and more communities. So I believe there will be some social change in India, and that these patriarchal norms will improve.
Right.
It's still a big problem.
Well, there's so much to talk to you, but time doesn't permit me, Dr. Shroff. But before I let you go, how do you feel conferences of this kind, which you attended, organized by CINS, help in creating awareness, and especially when bringing in the mind, body, soul concept? How is it going to change the future thinking, and how is it going to revolutionize the thinking of the medical professionals as well as the other professionals who believe in spirituality and holistic approach?
The rebirth of holistic ways of thinking and integrative ways of thinking has been going on for the past many years, and we are living in a time of great transformation
Right.
where these ancient ways of thinking are absolutely coming back to help us in the modern day. There is a widespread body of knowledge within allopathic medicine, which is tending towards integrative health. This new way of thinking, which is really an ancient way of thinking, a rebirth of an old way of thinking, is
Right.
taking all over the world. I've been doing this work since I did my PhD thesis on Ayurveda in India. And I published that in 1996. So since then, I've seen a great deal of receptiveness and openness towards wanting to see, particularly in chronic conditions, that there are new ways of doing things, that we must work towards prevention and health promotion, and that we must try to integrate the mind and the body and the spirit. There
Right.
really is a great deal of openness to this, and I feel very positive that we're going to come to this place of multi-paradigmatic thinking, where we're going to bring together all the systems of medicine that have something to offer, and we're going to have all of our people benefit from that around the world. India might be the leader in this area. Let's see.
Right. Great. It was a pleasure listening to you and understanding from you, from your wisdom. You have lots of experience, and of course, this will be, as you said, there is hope, and the kind of work that is being done from all these angles will definitely help the community at large. Thank you very much for your time.
Thank you so much, Harpreet.
Thank you, Ji. So, once again, welcome back. Our next guest is Dr. Bal Pawa. Dr. Pawa has spoken in the conference on role of how stress impacts our body, and she is a specialist on the issue of mind, body, and soul concept. And before I bring her on the stage, I would like to introduce her. Dr. Bal Pawa is uniquely qualified as a pharmacist and a medical doctor. The combined knowledge plus 30 years of clinical experience and being a patient herself of the medical system fueled her passion to change the way medical case is delivered. Dr. Pawa received additional certification in mind-body medicine, hormone health, and women's health. She has also received training for immune health and gut-brain health. This has positioned her as a sought-after speaker and author on integrative medicine and the mind body connection. And her book, The Mind Body Cure, Heal Your Pain, Anxiety, and Fatigue by Controlling Chronic Stress, is an international bestseller. So let's welcome Dr. Pawa and listen from her as to what she spoke at the conference and how we can also become in charge of our own health. Dr. Pawa, welcome to the program.
Thank you, G. Nice to be here again.
Thank you very much. So, Dr. Pawa, at the CINS conference which just concluded, you spoke about how you can become in charge of your own health, and especially when we talk about stress, that is taking a lot of toll on our body. So, could you please elaborate for the next 10-15 minutes, and then we would have a few questions for you.
Okay, sure. So I wrote this book, Harpreet, because I saw what was going on. For the last 30 years, I've been in medical practice, and I was first a pharmacist, as you said. So I was giving drugs and dispensing them. As a doctor, I was writing prescriptions. As a patient, I was taking drugs. And what I'm seeing is a very dangerous trend that we are using drugs to take care of every symptom. But 75% of the symptoms that come to a doctor's office are actually due to too much stress in the body. So when stress happens, our body makes a lot of stress hormones called cortisol and adrenaline. And when those two hormones are made all the time, they're not supposed to be on all the time. When they become chronic, they become intense, excessive, then things start going wrong. So if you think about insomnia, anxiety, depression, gut problems, headaches, muscle tension, hypertension, and the list goes on. And when you look at chronic diseases like diabetes and even cancer, arthritis, chronic diseases are also related to chronic stress. So I was seeing this trend. Stress causes disease, but we're not going to the root cause of the problem. We're just throwing drugs. So we have a pill for every ill. And when I saw this, I said, I have to do something, because I, as a patient, experienced that we have to teach people how to take care of their body, how to take charge of their health, and how to take charge of the emotional state. Because emotional state is equivalent to your physical state. So if your emotional state is not healthy, your physical state will be unhealthy. So when you think about it, look at it like this. Thoughts, our thoughts, we're thinking thoughts all day long, 60, 70,000 thoughts. If they're fear-based, negative thoughts, thoughts are the language of the mind. Feelings are the language of the body. So if I, as a doctor, say to a patient, how are you feeling? And he says, oh, I feel tired, my stomach hurts, my blood pressure is up. I'm measuring his feelings. I give him something for heartburn. I give him something for blood pressure. I give him something. But then if I ask more question, I said, okay, Mr. Singh, are you having trouble with finances? Oh, yes, I lost my job. Okay, what's going on in your family? Well, my son is involved with alcohol and he's not coming home at night. Okay, another stress. So you start seeing what is going on in their life and how stress is impacting his symptoms. So we have to learn to connect the dots and teach people how to connect the dots about their situation and how it's showing up in the body. Stress has to show up in the body. So the tools that I teach people, number one, be aware of what is going on. So connect the dots between your social situation, what's happening with your stress, and what's happening with your body. Connect the dots. Number two, I teach them you have to take charge of your health by learning to reset your body. You can do that with breathing techniques, yoga, going out in nature, doing some deep breathing exercises. So reset your body so it's not in fight or flight, it's in rest and repair. So when we put the body in rest and repair, our body can heal. So that's very important. And then the third thing I teach them, the power of the mind. And I say, look, if you start listening to your thoughts, you can stop, observe, detach, and affirm. I call it SODA formula, SODA, S-O-D-A. Mm-hmm. So what they can do is stop, and examine their thoughts. Oh, here I go again. I'm thinking negatively. Observe yourself, detach from the negative thoughts, and then affirm a new thought that is more positive, more trust based. But what you will see when you start practicing this formula, soda, your mind becomes more calm. You become more intention. But as a doctor, what am I going to see? Blood pressure goes down, heart rate goes down, breathing gets better, sleep gets better. So the feelings in the body change when we change our thoughts in the mind. So changing your mindset changes your disease, your physical state. Our emotional state changes the physical state. So that's some of the things that I teach in the book. And then I think we talked about, this reframe toolkit. I'm not sure if you saw this
Yeah, I can
last
see
time.
it. Yeah.
Yeah, so that's very important, Harpreet, because everybody right now, mental state has been really tough with pandemic for across our country and across the nations all over the world. Our mental state has been anxiety and fear, and now a little bit is lifting. We're seeing hope. I mean, India is still in a bad place, but we're seeing that things are changing. And the mental state of those people who went through the pandemic, some of them are coming out better, some are coming out worse. They have more anxiety, more depression. So their mental state is translating to physical state. So if you see what happened in Canada, our prescriptions for sleeping pills are gone up, prescription for anxiety pills, depression pills, 40% rise in prescription. So should we be taking more drugs, or should we go and fix what's broken? We should be fixing what's broken.
Yeah.
Let's fix our mental state. That is what's broken, and teach people how to be resilient and strong and give them the skills. We should be teaching it in the schools and children also, because that's one of the best life skills we can teach our kids, how to be resilient. And stress is never going away. This year it was pandemic. Next year might be something else. Stress is not going away. So we have to learn to adapt to stress and say stress is a part of life. And the more adaptable we are, the more resilient we are, then stronger our health will be much better, and we will be stronger because of that. So that's why I thought it's so important to teach these messages, and that's why I wrote the book.
Excellent. Dr. Pawa, your story yourself, what you went through is really inspirational, and how your change in the mindset brought about the desired change that you wanted to see in yourself. And after that, you have been spreading this message, and especially this book has been a kind of a wonderful thing for the people, where they can get all these resources and learn how to change yourself. And again, your soda formula is really good, and especially for men, they will not forget it. The soda formula is really good if you start implementing it.
Without the scotch, though, okay.
Absolutely. So now the question that arises is, people know about it, but what do you feel? Where does integrative medicine stand today? And especially when conferences of these kind are held, how do they help in further spreading this message? We have the best of the East, the wisdom from the East, and the best modern practices of the West. And when we amalgamate them, when we combine them, it can prove wonderful results. So in your practice, what do you see? Are people accepting this now, or still on both the sides there is some kind of hesitation?
That's wonderful you brought up that point. We should first talk about what is integrative medicine, because what we have right now is called intervention medicine. That
Right.
means you have a symptom, we give you a drug. You need this, you need surgery. So we have ways to do external intervention. We're always looking outside of us to find the cure. And what I'm saying is we need that sometimes. Of course, sometimes if you have appendicitis, you need appendix out. If you have severe infection, you need antibiotics. So we need that kind of medicine. But we should be putting more focus on prevention. And that's why I love integrative medicine. It involves your mind and your body and your soul, because that is a more sustainable and effective and affordable type of healthcare, when you involve the patient, you give them tools. Say, look, you are accountable for the choices you make. You can't change your genes, you can't change genetics, but you can change your choices. If you have diabetes, if you have heart disease, then when you have a good mindset, you will make better choices for your food, better choice for exercise, better choice for alcohol. You know, your lifestyle impacts your health. But when people are stressed, they make bad choices about health, right? So when they're stressed, they drink more. When they're stressed, they eat more junk food. When they're stressed, they don't sleep. So I'm saying, look, take care of the stress first. When you have a calm mind, you will make better choices for your health. You're more connected. You're more intentional about the choices you make. So that's why I always say start with the mind, because then you can integrate more health. And integrative medicine means connecting the whole system, looking at your diet, exercise, sleep, but more importantly, look at the mindset. That is who is making all the choices in the first place. So I'm really happy that Canada, India is bringing this integrative medicine, and Dr. Garg has been instrumental. He's been a pioneer, and I'm so honored to know him for the last 30 years. He's done some great work. So I'm honored to be invited to this conference. And I really love the work he's doing, because people are becoming more aware
Right.
and learning that this is very important. Integrative medicine is the future of their health.
And Dr. Baba, taking you back to your time when you started practicing it, as that time, this wasn't a much wider concept acceptable in the community as such. So you must have been scoffed at also, probably, that what are you doing? You know, you are leaving this interventional aspect and bringing in the integrative aspect. But now things are changing. Even in hospitals also, we are finding this is taking place and people are accepting, and even the medical fraternity also has started accepting it. But to the level where it should reach, what do you think? What needs to be done more?
I think it's largely consumer driven. People are looking, they're saying, I'm tired of taking drugs. It's $1 billion drug industry. Our healthcare is overburdened. There, I mean, for example, we cannot even get a patient to go and see a psychiatrist, 8-month waiting list.
Yeah.
So we have to do something, and we have to create prevention as the best model of healthcare and use intervention only for the very sick people. But if we can prevent sickness, that just makes financial sense, social sense, and psychological sense in every way. So I think education is one part, but next we have to start programs, and maybe the government can fund more preventative health. If you look at our healthcare model, Harpreet, this is called the intervention model.
Yeah.
It was designed for very sick patients by Tommy Douglas back, many decades ago when they set the Universal Healthcare Act in Canada. We have free healthcare, but we did not put any responsibility on the patient. We have to give patient education responsibility. We have
Right.
to involve the government. And I think we will see a big change coming in the next decade. People are tired of drugs.
Absolutely. Talking of an individual, when we talk about the mindset, our upbringing is such that the first thing that comes into mind is, a no. We have been brought up, generally studies. I was reading one book where it was said that when a child is growing up, apart from the encouragement that they get, the yes that they get from the parents, it is more of no's. So it gets ingrained in the mind. That negative mindset keeps on building up, and as we grow, things keep on changing. The stress, what you're talking, it's a modern day epidemic. So if you could elaborate a little bit on this aspect as to how can a common person, this apart from the soda concept that you introduced of stop, observe, detach, and affirm if a negative thought comes. But what else can be done so that we can keep our mind healthy?
I loved what you said about childhood. We form a lot of ideas about our health behaviors when we're children. We see our parents and see how they deal with stress. We see our parents, what choices they make. So we learn because we have taken identical twins and separated them and watched one twin is brought up in a house where they don't deal with stress, and another one is brought up in a house where they're taught how to deal with stress properly. And they're identical twins, identical DNA, but one twin has a better resilience and better outcome for health. So we know that if we can teach our kids to be more resilient and learn how to cope with stress, that in childhood, parents have an opportunity to teach them skills. So when stress comes, teach the kids how to do breathing. Teach them they have some control. They can't control outside. They can control the inside. How do they show up? Do they react or do they respond? If they react, they're going to get very agitated, panic, anxiety. But if they learn to take a deep breath and show up and say, inside, I have a choice. How do I show up? So teaching them some of those techniques, for example, in the schools, they have a program called Mind Up. Reading, writing, arithmetic, and relaxation. So the fourth life skill they're teaching now in kindergarten in LA and some of the larger cities is called Mind Up. They're teaching kids that your mind, you can make up your mind and teach these kids how to show up when they're stressed. So I think that's very powerful, teaching this skill in schools and in the home.
Very true. And especially, the concepts are changing now from IQ to EQ. Emotional quotient is more important now instead of the IQ. So as you said, you've given an example of in some schools this is taking place. But overall, what are you observing, Dr. Pawa, that the kind of knowledge, the kind of information that is available, are we as individuals ready to take charge of our own health, or still in this rat race, though pandemic has shown us what matters most, but still now things are opening up? And do you feel that we have learned a lesson, or we still will be coming back to that original thought what we had before this pandemic?
It's very interesting. Human behavior is what I've been studying for so long, and we are conditioned by our responses. Sometimes the ones who wake up and are more conscious, they make better choices. Others, they will continue to do the same thing. But if you do the same thing, you're going to get the same results. So if you want different results, you have to be conscious and aware. Awareness is the agent of change. So if you want to change your health, you have to become aware of how do you think, what kind of choices you make. So when you are very familiar with your mind and you're more conscious, then I think those people look for answers, and the answers are there. But if you are not conscious and you just wake up, do the same thing every day, you're going to get the same result as you did before. So those people who are coming to me, they have gone through this pandemic and they've become more awakened. They're more aware. And so they say, Dr. Pawa, can you teach me this? Can you teach? They look for reading material. They look on YouTube. How can I deal with this? So I think if you use pandemic to learn and grow, you will have better outcomes for your health in the future. When stress does come again, it will come again.
Absolutely. There's no doubt about it. Stress will keep on coming, but the way we handle it, it's going to make a difference. Dr. Pawa, it was a pleasure talking to you and learning from you. And as always, your words of wisdom are really very appreciative, and we can learn a lot and we can imbibe those things in our life and change ourselves. And especially when you say what we depend upon is pill for every ill, we need to come out of that thought and we need to take charge of our own health. Once again, thank you very much and best wishes.
Thank you. Thank you.
You heard from her. The Harpreet Singh Show has been collaborating with Canada India Network Society for the past 1 year, where every month on the second Tuesday of the month, Dr. Garg comes forward with different speakers. And we also had Dr. Farah Shroff in one of our programs. And today, what she talked in the conference, she has elaborated on that. So we would like to thank the entire staff, members of CINS who have organized this conference and given us an opportunity, the general public at large, to listen to the wisdom of the best speakers in their own respective fields. And the idea is to adopt that mind, body, soul concept. While the Western medicine is doing great in its strides, but the wisdom of the East also needs to be incorporated. And when both of these are combined in our lives, and when we start following the steps, what are told to us, then definitely we become in charge of our health and we can be much better, living a healthier life as far as the chronic diseases are concerned, because we are responsible for a lot of things: the sedentary lifestyle, the negative mindset that we keep on adopting. If these things, we understand what these revolutionaries, I would call them, they tell us, then definitely we become in charge of our own health and we become better. So once again, thank you to all of you also for sparing your time and listening to what our speakers have been saying in the past few days. Keep on listening to us, watching us every day, because all the speakers who spoke at CINS conference will be sharing their wisdom with you and telling you practical steps as to what all needs to be incorporated by you in your daily life. Once again, thank you very much. See you again. I meet you every evening at 7 p.m. Pacific Standard Time, and our focus is to educate you, empower you, and to inspire you. Thank you very much. Have a safe evening, stay healthy, and enjoy yourself.